Respiratory Therapy Lesson 1. What is a ventilator? This unit will cover the basics of respiratory therapy. The goal for this lesson is to understand what a ventilator is, the classification of ventilators, and the purposes of the ventilator. This is the content of this lesson. A ventilator is a life support device that assists or forces ventilation when the patient is unable to breathe on their own due to some health conditions. Ventilators are classified into the categories shown in the figure. First, there are two types of ventilators, for adults and for children. And there are two main types of ventilation for both adult and pediatric ventilators. The first type is invasive positive pressure ventilation that requires intubation and tracheostomy. The second type is non-invasive positive pressure ventilation such as mask ventilation. It is important to note that nasal continuous positive airway pressure, CPAP, and high-flow therapy are not classified as artificial ventilation, but as oxygen therapy. There are three main purposes of the ventilator: to maintain adequate ventilation, improve oxygenation, and reduce respiratory workload. If mechanical ventilation is indicated, it means that one or more of these three things cannot be maintained by the patient's own breathing. Let's go over the details one by one. First, the ventilator maintains adequate ventilation. The volume of ventilation, which is important for breathing, must be appropriate for the individual patient's physique. The optimal tidal volume for a patient on the ventilator is considered to be 6 to 8 milliliters per kilogram of body weight. The reason for using ideal body weight in the calculation is because the lung size is dependent on the height of a patient. In this way, the adequate amount of ventilation can be given to the patient by using a ventilator. Secondly, the ventilator improves oxygenation. Oxygen is taken into the blood through gas exchange in the alveoli. However, the patient who is indicated for artificial ventilation may have some kind of disorder that prevents them from taking in oxygen properly, resulting in decreased oxygenation of the blood. In such cases, the lungs need to be inflated with a ventilator, or high levels of oxygen need to be administered. The partial pressure of oxygen in the blood, PaO2, should be set at 80 to 100 mm of mercury. Lastly, the ventilator reduces the respiratory workload. The respiratory muscles of patients with tachypnea or labored breathing are very exhausted doing their best to improve oxygenation or maintain ventilation. This is where the ventilator comes in to help and rest the respiratory muscles. However, as will be discussed later, caution must be taken not to use the ventilator only for recovery from respiratory exhaustion, as this can lead to sedation, intubation, and other harmful effects. This is the end of Lesson 1. What is a ventilator? Make sure you've mastered the basic concepts before you move on to the next level.